Hi guys, I'm here today to demonstrate a dressing change on a general chest tube. All right, so these are all the supplies we need when we're doing our chest tube dressing changes. So we'll go over it in a little bit more detail. The first being are these drain sponges. They have the slits in them, so you'll need at least two of these. The next is we are gonna have a handful of our general 4x4 sponges. We need sterile gloves. We need clean gloves, tape, some saline solution, preferably in a syringe, and then a Sharpie to date and time and initial the dressing. I'm gonna gel in. I'm gonna get him in a good position, visualize that chest tube, and have all my supplies ready. So first step is we're obviously gonna take off the old dressing. This I'm going to do by putting on just a clean pair of gloves and obviously letting the patient know what I'm here for and what I'm going to do. Hey sir, I am going to change out your chest tube dressing, okay? So you'll feel me touching you, taking tape off. Let me know if I'm hurting you at any time. So what we're going to do is we're going to remove this old tape. If it's really stuck to him, we do have adhesive remover that you can use. But we want to be really careful taking it off so we don't dislodge that chest tube, obviously. And what I'll typically do is I'll support the chest tube as I pull the tape off. You can also, I've seen people use scissors around these dressings as well to try to get them off. All right. So now that I have that old dressing off, I'm gonna look around the site, assess, make sure that it looks okay. There's no leakage or anything like that. And then I'm gonna feel around the site as well. I'm gonna feel for any crepitus that would signify that there's air leaking into that subcu tissue. All right, and then next thing I'm gonna do is I'm gonna take off my gloves. So first thing I'm gonna do is I'm obviously gonna gel again after I remove my old gloves. And now I'm gonna create my sterile field. The replacement of this dressing is sterile, using sterile gloves. So I'll get everything ready for that. So what I'm gonna do is I have all my new gauzes. I have my sponge gauzes. They have the slits in them. So I will get those ready and opened. And then I'm going to get some regular gauzes opened as well, and we'll use a couple of those. All right. Next thing I'm going to do is we are going to clean the site with some saline. So what I'm going to do for this is I'm going to put some saline on one of these sterile gauzes. Get it nice and saturated. And then at this point I am going to go ahead and put my sterile gloves on. Okay, now that I have my sterile gloves on, I will go ahead and clean the site with this sterile gauze that I have made up. So we'll dab around it, get any excess skunk off, any blood. And then I will let that dry here for a second. All right, and then once that's dry, I'm gonna go ahead and place these gauze sponges around the site. So one, I go up with one, and then I'll go down with the other. And then typically what I do is I will put 1 or 2 of these 4x4 gauzes over the top. All right, and now that I have all my gauze on, I'm gonna go ahead and grab my tape and we'll secure this to the patient's chest. And what I typically do is make a window around the gauze to make sure it's nice and secure. And you never want to tape directly onto the chest tube itself. For even more securement, to make sure if you're worried about the chest tube getting dislodged or pulled, sometimes people will place a piece of tape lower as well. So you can secure it lower to the patient's chest or hip. That way, if it does get pulled, it's pulling directly on that tape. The last thing you want to do, you're no longer sterile, so you can take off your sterile gloves. Obviously, you would gel again, and then I'm going to go ahead and write onto this dressing. We always want to write the time and date that it was changed. So I'll say 10 a.m. and then I'll say 5:28, and then I always initial it too. That way, when someone comes and reassesses, they know exactly the time and date, and then they can track drainage as well from that time and date. Okay. Now that we've done the dressing change, I just want to clarify a couple things because things might have looked a little bit different than what you're used to with your chest tube dressing change. So our policy regarding chest tube dressings has changed within Policy Tech. It does align with Lippincott, and the more that we're merging with Intermountain, Lippincott is going to be our gold standard for procedures and processes such as a chest tube dressing change. One other thing is different tapes we can use when placing the chest tube dressings on. Our policy states tape that's very vague. So a couple options that we can see, such as GenSurge, they're preferring the Metapore tape. Cardiothoracic surgery, a little bit up in the air for what they want. So just clarify when you're doing your dressing change of what they prefer. One thing that we're trying to go away from, or there's question about, is the microfoam tape, because it actually creates pressure and can cause some skin breakdown, skin issues as well, just because it is really strong tape. Our Lippincott does mention some clear dressings, and then as well as paper tape. So I think the takeaway from that is just clarify with the provider of what type of tape they want. One other thing is that GenSurge previously had used the Xeroform around the chest tube dressing under your actual dressing placed. We are going away from this because it is causing maceration of the sutures as well as some skin issues, and this is evidence-based that we're going away from this. One other thing you might have noticed is that I used sterile gloves to place the dressing. So this is not new. Our old policy stated to place the dressing with sterile gloves. So that is something that we need to be doing as well. One thing we want to look at too There's question about how often we should be changing a chest tube. Per our current policy that is updated, there's no standard for how often it should be changed. Referring to like open heart patients, they come up with an order set from the ICU with order set of changing the dressing after 48 hours of insertion of that chest tube, and then you would change it daily after that 48-hour mark. When it comes to other floors, notifying the provider or questioning the provider of how often they want to change that dressing would be my recommendation.